going to give you some quick insight into the many aspects of the root and branch of shoulder pain. If you want to learn more, go to our website at eastwesthealing.com, go to the resources page. In about a week, you'll see a 2 to 4 hour audio called Scientific Shoulder Training. I'm speaking for the Czech Institute, and you can learn more about the muscular, neurological, and osseous anatomy into the many facets of why people have shoulder pain, as well as faulty exercise programming and faulty working out principles. And you can learn more about that in that program. What you're going to see in front of you next is a diagram from Differential Diagnosis and Physical Therapy. They show that the many reflex patterns of the organs, you're seeing these pink patterns from the liver, gallbladder, stomach, kidney, testes, diaphragm, kidney, and bladder, and much more, can cause shoulder pain. The more common ones are the liver, gallbladder, and the stomach. Some examples are liver inflammation, eating foods that contain additives and preservatives, having gallstones or a gallbladder that's kind of backed up or inflamed, being deficient in hydrochloric acid, for instance, actually causes wing scapula or atrophy of the rhomboids because the stomach is innervated from thoracic basically T5 to T9. Okay, and we're treating the shoulder where it could be coming from somewhere else. So this is a great diagram and a great book to look into possibly why you might have a shoulder instability that's not getting better. Okay. Another great book is called Clinical Examination of the Shoulder by Todd Ellenbecker. And he shows how many neck problems can cause shoulder pain, and you see some of the ones in front of you, okay, such as nodules in the neck. He shows that chest problems, and these are very common, breast diseases and angina can cause shoulder problems. He shows how abdominal issues of the liver, the gallbladder, the spleen, the stomach, the diaphragm, hiatal hernias can cause shoulder problems, and how many systemic diseases like gout and diabetes can cause shoulder pain. So if we look at respiration, how do you develop shoulder problems from respiration? Well, it's pretty simple. If you breathe invertedly, you use your diaphragm, it's your main respiratory muscle. You have accessory muscles like your scalenes, levator scapula, things like that in the neck. They're meant to be used to help out lift the rib cage when you breathe properly. If you chest breathe, you actually breathe 20,000 times more per day. So you put a lot of stress through these muscles. A lot of these muscles are shoulder, neck, and head muscles. They attach from the shoulder to the neck or the shoulder to the head. Okay? So if you're using them too much, they become hypertonic. The tension in them increases. You develop trigger points. So you can actually have referral pains from these muscles to the shoulders. A common one is the omohyoid muscle of the neck, okay, as well as the trapezius. They go from the head to the shoulder. So if you have respiratory issues or shoulder pain, get it looked at, because if you're treating the shoulder, you're treating the branch, and you're not getting to the root of the issue. Okay. Another common issue that people have is cervical issues, from facet joint inflammation, a cervical disc problem, degeneration, osteophytes, forward head posture, a flat cervical spine. We could go on and on and on and on with cervical issues, but a lot of the muscles that attach to the cervical spine, such as the levator scapula, actually attach to the scapula or the shoulder. The scapula is actually part of the shoulder. So let's say you have an issue with the C1 through C4, or you have a disc problem, a degeneration. This can refer to the shoulder and cause instability of the shoulder. So you can see how cervical issues can actually create shoulder problems. Okay. Another common one is the trapezius, like I talked about. So if the trapezius is hypertonic or has issues, it can refer to the shoulder. There's many other cervical muscles or cervical issues that can refer to the shoulder, but we're going to keep it simple, like I said. Okay. And most people, from x-rays and from working with chiropractors, most people have cervical issues. Another one is atlas subluxations. This is a bone at the base of your skull. This is a gigantic topic. If your atlas is sublux or shifted in any direction, this can refer to the shoulder, right? Certain muscles like the suboccipitals at the base of the skull, levator scapula, are actually attached to the atlas. All these muscles, if they're dysfunctional, or if the atlas is dysfunctional, can actually refer to those muscles and refer to the shoulder, causing a shoulder problem, okay, such as an instability or an impingement syndrome, okay, because the shoulder is a foundation for the neck. So if the neck is dysfunctional, the shoulder is going to be dysfunctional, okay. Another common thing with an atlas subluxation is from chewing on one side or having a TMJ problem. This causes hypertonicity in the suboccipitals. These attach to the atlas and the spinal cord, wind the spinal cord. Not only can refer to the shoulder, but can refer to the hip, knee, and ankle, and things like that, okay? Another common issue that we're going to look at is hip, knee, and ankle. Well, the funny thing is, a lot of the muscles that attach to the shoulder, one in particular being the latissimus, actually goes contralateral to the other side of the body through the thoracolumbar fascia. It attaches to the opposite glute maximus, which attaches to the TFL, or the IT band, which crosses the knee. So is the lat a shoulder, back, hip, or knee or ankle muscle? So what you commonly see is all these people with these knee problems, ankle problems, and hip problems, and it actually could be coming from the shoulder, or vice versa. You see people with common, chronic knee surgeries, chronic ankle surgeries, or ankle sprains, hip problems, when it could be coming from an instability of the shoulder. The body is connected. So if the shoulder is unstable on the right side, the left hip, knee, and ankle is going to be unstable on the left, on the opposite side. Okay, so the right shoulder goes with the left hip, knee, and ankle, and the right shoulder goes with the left shoulder goes with the right hip, knee, and ankle. Okay, hopefully you've learned something. Stay tuned. If you want to learn more, like I said, go to our resources page. This is just a quick clip to give you some insight into other factors or other routes into what could be causing your shoulder problem.